This particular module will look at the equipment typically used in EMS for the lifting and moving of patients. The information contained within this module is essentially a review of patient movement equipment utilized at the EMT level. As a result, this module will not go into great depth as paramedic students should already be familiar with patient movement equipment utilized at the BLS level. Once completed with this module, you should be able to describe the types of patient movement equipment available to EMS providers and how such equipment is used. Probably one of the most common and identifiable pieces of equipment used by EMS for patient movement is the stretcher or cot. The most basic type of stretcher used by EMS is the wheeled stretcher. This stretcher has collapsible legs with wheels so that the height of the stretcher can be adjusted and the stretcher can be pushed or pulled over flat terrain on its wheels. Over the years, these stretchers have evolved to incorporate pneumatic or electronic mechanical features to extend or retract the legs, which goes a long way in helping prevent back injuries associated with EMS providers lifting and lowering patients while on these devices. A portable stretcher is simply a piece of fabric or something similar stretched over a frame with handles at the top and bottom. These stretchers do not have legs like a wheeled stretcher and therefore are not ideal for patient movement, especially if the patient is heavy or must be moved over a long distance. On the other hand, the Spartan nature of a portable stretcher makes it much easier to use in restricted or limited access areas. Portable stretchers may also be used in conjunction with the ambulance's bench seat to transport more than one patient at a time. Flexible stretchers are a type of portable stretcher, although they do not incorporate any type of rigid frame. Rather, the material is a semi-rigid, quasi-flexible plastic or composite that can be wrapped around the patient and secured with ropes or webbing through grommets incorporated within the device itself. Another type of portable stretcher is a basket stretcher, Stokes basket, Stokes stretcher, or Stokes litter, depending on what your agency decides to call it. This particular stretcher is made of rigid plastic, composite, or metal with an extended lip that comes up around the entire device. Handles are built directly into this lip, which allows for easy carrying by EMS providers. These basket stretchers are large enough to accommodate the length of a rigid longboard and, if rated for the particular use, may be used along with rope systems to extricate patients from limited access and remote areas while also providing for spinal immobilization. Scoop stretchers, also known as orthopedic stretchers, are designed to come apart in 2 or 4 pieces to facilitate application underneath a patient without having to actually move the patient to place him or her on the stretcher. The stretcher is effectively taken apart, wedged under the patient, and reassembled in place under the patient. Once the stretcher is reassembled under the patient, the EMS providers can then lift the patient while on the scoop stretcher to transition the patient to a longboard or a wheeled stretcher for further movement. If you need to move a very large, obese patient, a traditional wheeled stretcher may not be adequate as wheeled stretchers are relatively narrow, which can be a tipping hazard when the stretcher is elevated, and they are also rated to carry patients only up to a certain weight. To address the need of moving large, obese patients, some EMS agencies have bariatric stretchers that are designed to accommodate both the extra width and weight of these patients. We will discuss bariatric patient movement and transport considerations in greater depth a little later in this module. EMS providers are often called upon to move patients up and down stairs. Stair chairs were designed to facilitate such moves. Stair chairs are essentially chairs that are engineered with wheels, treads, seatbelts or straps, and handles to make the job of moving patients up and down stairs easier for EMS providers. Stair chairs are typically foldable, making them easy to store in an ambulance compartment until needed. If you are called upon to move a neonatal patient from one hospital to another as part of your paramedic duties, a neonatal isolette, often referred to as an incubator, is used to keep the neonatal patient within a warm, clean, and properly humidified environment. Some isolettes are designed to be placed onto a wheeled stretcher, while others are self-contained with their own collapsible legs and wheels. All of the devices discussed on this slide have inherent strengths as well as weaknesses, meaning some may be more appropriate than others for patient movement depending upon the scenario and circumstances. It will be up to you as an EMS provider to use critical thinking to determine how best to move patients in challenging environments with the equipment you have available. While backboards were used historically for full spinal immobilization of patients with suspected C-spine injury based upon the mechanism of injury, emerging research and practice has begun to recognize that longboarding and fully immobilizing these patients may actually cause more harm than good. With that being said, backboards are still very useful for the movement of patients from the area in which they are found to a wheeled stretcher. Backboards come in essentially two types, long and short. Long backboards are typically somewhere in the neighborhood of just over 6 feet in length and are a category of EMS equipment that includes several of the devices we already discussed, like scoop and flexible stretchers. A long backboard is simply a wooden, plastic, or composite board upon which the patient is secured in a supine position for movement. Short backboards are about half the length of a long backboard, typically somewhere around 3 to 4 feet in length. Similar to long backboards, they are made out of wood, plastic, or composite. Over time, the short backboard has evolved to incorporate straps and other wraparound features to make them appear more like a vest that can be used for patient movement. The Kendrick extrication device is an example of a vest-type short backboard. Maintenance of your patient movement equipment is very important. It is also very specific to the piece of equipment. For example, a powered stretcher will have more maintenance than a plastic longboard. Regardless of the piece of equipment being discussed, you should always follow the manufacturer's directions for cleaning and maintenance. When positioning a patient for transport, remember what you learned as an EMT because the same principles apply. If the patient is unresponsive and does not have any suspected spinal injury, place the patient into the recovery position. If the patient has chest pain or difficulty breathing, attempt to keep the patient in a position of comfort, such as a Fowler or semi-Fowler position. If your patient has a suspected spine injury, ensure the patient is immobilized per your agency's protocols. In the past, this used to mean full immobilization on a longboard with a C-collar and cervical immobilization devices. Now, with selective spinal immobilization protocols becoming more popular, this may mean using a vacuum mattress, the cot itself, patient self-splinting, a C-collar, or other means to ensure the patient's spine is properly immobilized without generating additional problems or discomfort. If your patient is pregnant and hypotensive, she should be positioned on her left side. Nauseated or vomiting patients should be transported in a position of comfort that typically allows the patient to expectorate into a dish or container while maintaining his or her own airway. As discussed briefly before, EMS is seeing more patients who suffer from obesity. As a matter of fact, the CDC reports that, as of 2017, 30.1% of all adults in the United States are obese with a BMI of 30 or more, and 14.8% of adolescents in grades 9 through 12 are obese. These numbers have also been increasing steadily over time. The obesity rates for adults was 27.4% in 2011 and 10.5% for adolescents in 2001. These rates are in addition to those for overweight classifications, with an additional 35.3% of the United States adult population having a BMI greater than 25 but below 30 in 2017. An additional 15.6% of adolescents were considered to be overweight by the CDC in 2017 as well. Therefore, as of 2017, almost 2 out of every 3 adults in the United States was considered to be overweight or obese. Patients who are significantly overweight are classified as bariatric. How bariatric is defined can vary by the organization providing the definition. According to the World Health Organization and the CDC, people with a BMI greater than 30 are obese. Individuals with a BMI greater than 40 are severely obese. In terms of overall weight, if a person is more than 100 pounds overweight or weighs more than 300 pounds, they are commonly considered to be bariatric. Lifting, moving, and transporting bariatric patients can be challenging for EMS as these patients commonly present in environments with limited access. Residential and other properties with several flights of narrow stairs, narrow doorways, narrow hallways, no elevator or an elevator that is too small, and the like are all too common. EMS equipment is also rated to handle patients up to a certain weight, and some bariatric patients may very well exceed those ratings. For these reasons, many ambulance agencies are beginning to equip ambulances with specialized bariatric equipment, such as specialized bariatric stretchers with wider wheelbases and more load-bearing capacity that may accommodate up to 850 or 900 pounds, or power patient lifting devices to lift heavy patients off the floor so they can be more easily transitioned onto a stretcher. Some agencies have even begun modifying ambulances themselves to include ramps or winches to assist the crew with loading the bariatric patient into the back of the ambulance. While bariatric patients can present numerous challenges for an EMS crew, the one that is most pertinent to this particular module is obviously related to lifting and moving the bariatric patient. While EMS crews must always be mindful of having enough personnel to safely lift and move patients, the increased weight of a bariatric patient makes this aspect of patient care even more important, as errors in lifting and moving bariatric patients can have significant negative repercussions for both the patient as well as the individual EMS providers. Therefore, EMS crews must ensure they have or obtain adequate personnel on scene to lift and move the bariatric patient. Whenever possible, use equipment designed to help lift and move a bariatric patient, such as lift belts or mechanical devices if available. Keep principles of mechanical advantage in mind and always be sure to lift while using proper body positioning and lifting mechanics, as we discussed in a previous module. If you have access to a bariatric ambulance within your area, it may be prudent to ask that unit to respond. Again, use all available resources and ensure adequate personnel on scene to minimize risk to the patient and the EMS crew when lifting and moving bariatric patients. That brings us to the end of this module, and you should now be able to describe various types of patient movement equipment and how they are used by the paramedic. This presentation was prepared by Waukesha County Technical College in Pewaukee, Wisconsin, and is distributed with an Attribution, Non-Commercial, Share-alike 4.0 International Creative Commons license. Copyright 2019, Waukesha County Technical College. For information on WCTC's numerous fire and EMS educational offerings, please visit us online at wctc.edu.